Lovely to see you, which is quite good. Let's hope it stays that way. Before we do anything, some people have already said, and I did mine yesterday, but I feel I have to do it again. I think we would all be exceedingly happy to say to Jane McSherry, we are happy she is in the position that she's in and was given. Well, Jude, and we come a long way. I've known you forever, and I think it's a fantastic position that you're in, which suits you very well. So we hope to keep you. Don't go anywhere in a hurry. Thank you.
Thank you, Chair.
I don't want to call everybody's name because this meeting is going to be exceedingly long. 7:15 till 10:15. It might not last that long. What I'm asking is that sometimes people try to speak with everybody else is speaking in spite of trying to keep us in order. And please don't ask a question that's been asked before, because otherwise we'll stay even longer and nobody wants to do that. So we will begin by asking any apologies for absence, please.
No apologies, Chair.
I cannot see Nick, so who is there for Nick?
Substituting for Nick, Councillor Draper.
Right, okay, thank you. So that's fine. Okay. Any declaration of pecuniary interest? Seems all quiet, so I take that as no. Minutes of the previous meeting?
Chair, I did spot a spelling mistake on page 3.
Okay. If you highlight that and give it to Stella, please.
Yeah, it's in the heading. It's quite easy to spot.
Okay, right.
Yeah,
Thank you.
it's the only heading on that page 3.
Right, great. Because we've got such a long agenda, and the reason mainly, I think, and I think we'll all agree, COVID has stopped a lot of things. And the meetings were cancelled, and now they've been reinstated, but we have missed out some. And it's this time of the year when everything needs to be checked and seen to. And so that's why the meetings look so long. So I've changed the agenda around a bit with permission and discussion with senior staff members. And so therefore, we are going to start though with Dr. Dagmar, because we wouldn't like to keep her here all night when she doesn't have to listen to everything else. So if you wouldn't mind starting, please.
Okay, many thanks, really appreciate it, and good evening, everybody. So I think I know you all. I'm Dagmar Zeuner, Director of Public Health, just in case it was a long time we exchanged faces. So Stella, I've got a few slides, but I know that you've got a full agenda, so I will whiz through. I will give you a brief overview of the COVID situation as it stands now. If you give me the first slide, Stella. So as a summary, the good news, it can't have escaped you. The infections have fallen, and they have fallen in Merton. I'm not completely relaxed. We are hovering now, so the fall has stopped. We are between 20 and 30 per 100,000 in a week. And that's not high, but that's not super low either. We have to keep our guards up. 2 particular potential threats around us. One is with the increasing of the opening up of society. Are we or are we not going into a next wave? The trajectories aren't sure, but they're not excluding it either in the summer or more likely in the autumn. And the other one is more immediate. It's the variants of concerns. The particular ones in our country still is the one from South Africa because of the vaccine escape. The next down the list is the one from Brazil. And then in not yet a variant of concern, a variant under investigation is the one in India. So these are the 2 threats. It's not on this slide, but just so you know, we had an outbreak of the South African variant in our neighbouring boroughs, one in Wandsworth, one in Lambeth, in a care home and in a primary school. They were actually linked, so we were very much on guard in Merton, but so far it hasn't come to us. But as you can imagine, we are on alert. If you move us on. That shows you that London on the whole is much more stable now. That is very, very important because obviously borough borders are porous. If you move us on. This is an important picture because you will be aware one of the important tests for further opening up is what is the impact on the NHS. So the direct impact on the NHS of COVID patients has now absolutely gone down. You can see that in the shape of the curves. Our NHS colleagues, however, are not idle in the slightest. They have a huge backlog to deal with. And so when we're going along the roadmap and the test around the pressure on the NHS is looked at, even at a lower COVID, potential lower COVID infection rate, if admissions start to creep up again in the NHS is less placed to cope with that again because of the huge backlog. So that's quite an important consideration. If you move us on. Few slides on local analysis. You show us in comparison to our neighbouring boroughs, and what you see as well is that it's bumping up and down quite a bit. So Merton was leading for a while, and as you can imagine, then everybody is particularly with a heightened concern, but smaller numbers make it much easier in that there's just random fluctuation. We behind the scenes pore over all the data and with our colleagues in London, check whether there are any pattern so that we can put control measures in place. And at the moment, it is pretty much household transmission. If you move us on. So this one shows you the age distribution, particularly on the right-hand side. It's a heat map. And you can see not too long ago, a month ago or so, we did have a bit of heat amongst the youngsters, so after the opening up of the schools, but that really has faded out. And so at the moment, touch wood, we haven't really got a strong signal. The cases that we still see are mainly in working adults. If you move us on. We're also always keeping an eye on East and West, and so we have here two groups of children and young people, and we have looked at what the case rates do. With the smaller numbers, it is quite a sort of uneven curve. That is more the reason of random fluctuation rather than any specific trends. If you move us on. I won't bore you. There are some testing slides. I hope they will be useful as a reference, but I won't spend time going through the details. If you move us on. That's another one about testing. I want to show you the ones with the LFTs. If you move us on. So this is worth just having a look. I think I can't praise enough our schools how they have embraced the request to do asymptomatic testing. And obviously initially when schools went back on the 8th of March, schools were tasked to supervise the tests first. That was quite a big ask. They did that admirably. And it is now over to home testing, and really the kids do it, the staff do it. And you can see there was a bit of a lull in the uptake over the Easter break, fair enough, but it has gone back up. And we are also supporting our early years staff. There it is the staff, not the little ones, to test regularly. And just if you wouldn't mind promoting, you will be aware there's now a universal program of access to lateral flow testing, and people can just collect their home test kits. They can order them over the internet, but if they're not 100% sure, they can have it assisted as well. And often what we recommend is, if people are unsure, to have the first one under supervised conditions. There every step is explained. they do their swab themselves, and then they can collect. And we call that model test first, collect second. If you move us on. So that was just a quick whistle tour through the data. I've got 2 more slides just with a few bullet points around overview from the school and attendance. And I don't know whether my CSF colleagues are probably better placed, but for me, I mean, it stuck out. As I said, the schools have really embraced the opening up, the testing, the restrictions, the face masks admirably. And attendance figures have been really positive, so over 95%. There's one more slide. And that's around the testing, a few more details. You might want to know what the positivity is. The data, to be completely honest, are a little bit shaky, but the positivity is very low. So we recently are only aware of, I'm only aware of 1 positive LFT, and so it hovers at the sort of 0.1% mark. That is comparable with elsewhere. I think that's me done. Thank you.
Thank you very much. Any questions, please? No? Wow. Oh, sir. Okay, Carl.
You might not be able to answer this, because by the sounds of it, there isn't lots of data. But I was wondering, in terms of the testing, are people that are testing positive isolating, and is that having a demonstrable impact on the spread of COVID in schools?
I think it's a spot-on question, Carl. You probably have read quite a bit as well. There's a Public Accounts Committee report that was quite critical. We test a lot of the national policy is testing. And then we forget that test on its own is not the intervention. You then need to self-isolate. And we know that the self-isolation is the weakest link in the chain. We do not regularly track whether people self-isolate. There are studies and surveys. That's how people understand that it is the weakest link, because if they have a random sample that they then follow up regularly, they find out that some people actually cannot self-isolate. And what is some of the quite concerning ways why we are locally really putting a lot of effort into thinking around the self-isolation is that people now make really quite calculated decisions that they say, even if they have symptoms, if I can't self-isolate, I'm not testing, because once they're tested, they're in the system. And that is obviously a real problem, because the furthest and the most spread you get of people that are symptomatic because they cough. Yeah, so in what is really important, what we've also done when we had the enhanced testing in Pollard's Hill, is to really push the message out that we are there to try to help people with self-isolation. And that is not just financial, but also other tips in how we can make it more bearable if they can't get food, for example. But you're completely right, weakest link.
Thank you. Anyone else? No. Can I then ask the question, please? How near are we to herd immunization? Or is that not possible to answer?
No, it is a really good question. I haven't got exact figures up my sleeve, but what we know is that the vaccination offer has just been opened up for the over 44-year-olds. And so we are making inroads amongst the adult population. So I think it is approximately 50% of the population is now vaccinated. That is not yet herd immunity. I think herd immunity for this disease, but don't quote me, is sort of 85%, so not there. But when we study the antibody profile, it has really gone up, because there again, surveys, national surveys going on, London surveys going on, so how many people have antibodies, and the combination of having had an infection plus the real big success of the vaccination program have really bumped up the number of people that have antibodies, but not quite there yet. And a really good question, because lots of people ask me at the moment in this country, the message is still very much you cannot change your behavior even if you're vaccinated. And that is quite hard to understand for people. But at the moment, people are still very unsure how much the vaccination, it protects you from illness, but how much it protects you from transmitting the virus. And they're very cautious at the moment. So we are advising people, even if they have both vaccinations, behave as if you haven't had it and test twice weekly. Now, I'm expecting that this will be reviewed, but that is the message for the time being.
Thank you very much. Councillor Henry?
Yeah, apologies, it isn't a question. And Dagmar, I know that you do a great
Okay.
job, and I don't wish to correct you, but I thought it was opened up for anybody over 42 as of today, not 44.
Oh,
And
and you
with it being
are
with it being a public
absolutely
meeting, you know,
good.
I just
No,
wanted
no,
to
no.
make sure that that's on record for the right age group, so we're not missing out.
Thanks,
too many.
Hayley.
Yeah.
Thank you. Appreciated.
Okay,
Thank
thanks, Helen. Councillor Henry, Joan, please.
Right, thank you, Chair, and thank you, Dr. Dagmar, and thank for all the hard work that you and your team have been carrying through since the pandemic. What I would like to ask, which are the most popular vaccine used and why?
Okay, so I don't know which one is the most popular. I'm not sure whether that might be the most helpful question, because probably different groups in the population, if you would give them the choice, would choose different vaccines. And as you're aware, the recommendation now, not the licensing, but the recommendation now for the 18 to 30-year-olds is that they would go for the Pfizer or the Moderna, so an RNA vaccine, and not the AstraZeneca or the Johnson & Johnson. And the Johnson & Johnson isn't licensed here at the moment.
Dan,
Yes,
your hand up.
yes. Did you say that if you got a double vaccination, that you should have 2 weekly tests?
Yeah. So at the moment, absolutely. So if you are out and about in any way, if you go shopping, or if you have to go to the office, or if you use public transport, or if you are meeting as you're allowed outside with people, absolutely. Anybody who is in contact with anybody else is recommended to twice weekly test. And it's in a way a belt and braces approach. And once you get into the habit of it, it's not that pleasant with the swab up the nose and in the throat, but it's a quick job, and the tests are free. You can collect them in any pharmacy.
Yeah, but is it easily done?
Yeah, it is. And as I said, if you're not 100% sure, what I would suggest is that you go to a site, again, in the community pharmacy, where for the first time they show you how to do it all. It's a supervised testing, and then you can collect at the same time a whole pack. They come in packs of 7 you can take home, and there's an instruction booklet in there as well, and then you can do it at home.
Thank you. Thank you.
You didn't hear me. Yes, thank you very much, Dagmar, for all of that, and you and your team. And hopefully, you'll be able to get some rest soon.
Thank you very much.
Have a good
All right.
evening.
Bye-bye. Thank
Bye.
you.
Okay, the rest of the agenda, we've changed a bit. And so now we're going to school standards annual report, but that will be linked with department presentation, update presentation. Right. And Jane, were you going Were you going to present that, or who did you want to do it?
So Chair, I think we had thought we were doing the school standards report and then the corporate parenting reports, and then we'll do the departmental update. So that
Okay,
we have
okay,
a
that's
number
fine.
of officers here. So I'm going to pass over to Elizabeth to introduce it, and she will liaise with Keith to introduce his parts.
Thank you, Jane. Thank you, Chair. So this is our annual standards report for the academic year 2019-2020. So it is the academic year which finished last summer. It does seem some time ago, and of course that academic year included just over a term's worth of lockdown. So there was much normal work which was undertaken by schools and with schools in those first just short of 2 terms, and then very different work with schools in the 3rd term. And in that 3rd term, of course, just to acknowledge the extraordinary work that was undertaken by our schools to keep children in school and to support them as well. The report, which is linked to the layout of the report, will be linked to our presentation. Much of it will be familiar to those of you who have seen these annual reports that we have done before. So we have included similar sorts of information, but some parts are missing. And when I say they are missing deliberately because there were the assessments, as you know, were significantly different, and there were much fewer assessments both at primary and secondary last year. So the chapters about that are missing, but then there are some additions in there around the COVID response. If you are able to see the report in front of you, either electronically or in paper form, I would just point out some key pages. If you haven't had an opportunity, these were our key pages towards the front of the report in particular. There is an executive summary of the report on pages 9 to 11. And that includes the headline outcomes from each chapter. There is a summary of performance information on pages 12 and 13, and a summary of the priorities which we're currently addressing in the new academic year 2020-21 on pages 14 and 15. I would just alert you to, and I'm sure you have already guessed, and again, you may recognize this from previous years, when we create the report, we create it outside your set of papers. So when we refer to page numbers in the report, it may be different from those that you have got in front of you because it is included within the bundle of papers that you have. So just to go again, sort of briefly overview of the report, chapter 2 of the report includes the context for schools during that year of 2019-20. It outlines particularly what happened with regards to COVID, but more generally as well, and what our ongoing school improvement functions in Merton have included. Chapter 3 is about our Ofsted outcomes, so the Ofsted outcomes for schools during the year. Chapter 4 is the shortened chapter because this is where we are missing achievement data for key stages 1 and 2 and the early years foundation stage. And it is just worth pointing out the phonics data in there. It is comparable with previous years. We are encouraged to do so. But the phonics test for the year 1 pupils was taken in the autumn term, last autumn term, December 2020. But it relates to the performance of the children who were in year 1 when they should have taken the phonics screening check in June last year. It also includes the data for our NEET, our young people in terms of the raising participation age, the apprenticeship guarantee, apprenticeship participation and September guarantee. We also include achievement of the children in the virtual school, and then a chapter on inclusion, a significant chapter on inclusion, as you can understand, particularly during COVID, the importance of looking at attendance, exclusion, elective home education, and children missing education. Yeah, I will just go into a little bit of detail, if I may, around pages 16 to 18 of the report, which talk about what happened for schools during the COVID time. As I said, well, we as you will remember, but it may seem very close, it may seem a long time ago. We went down into lockdown in March, and schools had to respond incredibly quickly to that. Government guidance was coming at schools left, right and centre, and we tried to support them as a local authority with that government guidance and to help them to problem solve around issues as they sort of felt their way through a situation which they had not encountered before. But on page 17, you can see the kind of support that the local authority provided to schools during this time. I will then, if I may, refer you to page 28. Page 28 is around our Ofsted outcomes. So we had 2 terms from September 2019 to almost the end of the spring term 2020, during which time we had normal Ofsted inspection. We had a new inspection framework, which you may remember me talking about last year, which has a focus particularly on the quality of education. It's on the curriculum and the leadership of the curriculum and the delivery of that curriculum. We only had 5 schools inspected during the year under this new framework, and they all retained their good outcomes. We are obviously looking forward to or trying to understand what Ofsted are going to be doing in terms of inspecting our schools going forward. This term, they continue mostly to inspect schools that are currently judged to be requires improvement or inadequate. And some good schools where they have already been at least 5 years without inspection, or that anniversary is coming up soon. So reduced inspection again this term. So definitely picking up next term when we expect them to return to full inspection, and we are working with schools to prepare. I thought I would throw that in, although obviously it's not relevant to the academic year 1920, but it puts into perspective. We will have a lot of inspections next year, I expect. Overall, the proportion of schools judged to be good or outstanding continues to stand at 95%. That is all our special schools and our secondary schools are good or outstanding. There are 3 primary schools which remain less than good. Those schools are West Wimbledon, Stanford, and Benedict. So if I could then refer you briefly to pages 35 onwards, that is where we have the outcomes for the phonics screening check that I referred to earlier on. We have our averages there at 84%. We are in line with London and just above national. Moving swiftly onwards to the Key Stage 4 outcomes, which can be found on pages 43 and onwards. So pages 43 and onwards will show it was to be expected, as you understand, if you have had much involvement in terms of understanding what schools had to produce last year, the attainment 8 score was expected to increase because they were not based, it was not, outcomes when exam grades were not based on exams. They were based on centre assessed grades, or CAGs for short. But if we're thinking about our relative performance, we're above national and in line with the London average for Key Stage 4. Key Stage 5 or post-16 outcomes can be found on pages 47 and afterwards. So towards the bottom of page 47, you can see that our APS, our average point score per entry for the different types of exams and assessments that students undertake in this phase, our APS is above the London and national averages in all cases, with the exception in one indicator where we're just in line with the national. You may remember that our continued focus is on improving the proportion of students achieving the higher grades at A levels. Again, because these are based on centre assessed grades, the CAGs, this has gone up. We remain below the national and local averages, but the gap with the national and local averages has diminished. So hopefully showing the impact of some of the work that is happening there. Across this report, we make reference to the performance of pupil groups, which remains, which is varied on the basis of the data we have. And suffice to say that our focus groups for this current year are pupils eligible for the pupil premium grant or free school meals, and Black pupil groups as well. And that is not just because of what the figures are telling us. Again, just to sort of reference COVID as well. Again, you may well have read from your various sources that more disadvantaged pupils have suffered more in terms of academic progress during the lockdown, and so the focus that needs to be on those pupils eligible for the pupil premium grant needs to be greater now. Black pupil groups, again, the data tells us that, but I think probably to make reference here to schools' response to George Floyd and to Black Lives Matter and to the general race equality issues that came to the forefront again last summer. Schools have responded. We have set up a Black Lives Matter and Equalities Forum with our schools, and we have been working together on how we can better understand the needs of Black pupil groups, but also other pupil groups from other ethnic minorities, working together how we can understand and what action we can take to ensure that their outcomes are equally as strong as other groups. I'm going to pause there and hand over to Keith, who will then be able to talk about the headlines within the next part of the report, which is around NEET onwards. And I think, Keith, I would be right in saying to refer councillors to pages 49 and onwards.
Thank you very much. Hopefully you can all hear me. I've had a terrible day on Zoom, so if I become a robot, I may have to disappear from my camera for a while, but I hope you can hear that fine. Yeah, so page 49 onwards. Thank you very much, Elizabeth. Elizabeth's already said that this year was a very unique year, and I think for the data you'll see in various sections under inclusion, it's quite a unique year as well. So in terms of NEET and not known, that's the first section, which is on page 49 onwards. That figure is taken from the winter period every year, and you'll see that the figures from that year were very much in line of previous years. So we have continued to have very, very low NEET. In fact, although we had exactly the same level of NEET not known, we've actually become 8th lowest in the country. So we improved our position because other parts of the country, their NEET deteriorated. The position, I think it's relevant to say now, the position currently, because you'd be interested to note that, although these figures are obviously about last year, is also quite strong. So a lot of young people have maintained their position in schools and colleges, and it's a strong position. Our concern is over 18's NEET, which is a more worrying picture, but these figures go 16 to 18. So in 16 to 18 NEET in this particular year we're looking at was very strong, and we continue to have good figures. If we move on from page 49, you then look at the figures around raising participation age. That's measured at a slightly different point in the year, but again, very strong, above London, above national. and comparative data that is reliable at that point. I make the caveat every year that our percentage around apprenticeships is low, and we're lower than national, and that's because we have so many young people in education. So our numbers in college and our numbers in school sixth forms are very strong. So our numbers in percentage of apprenticeships is concurrently obviously slightly lower. It has risen though from 1.9% to 2.4%, which is a good picture, because we want more of our young people not being neat and in apprenticeships. Moving on from that, you then get the data around what's called September Guarantee. That's a number of young people that have an offer of a place for the following year. The stronger your September Guarantee, the stronger you are transferring young people from year 11 and year 12 into year 12 and 13. And you can see yet again our figures are very strong, better than London and better than national. So it's a very, very good supportive figure. If you move on now to the inclusion section, which begins on page 63 of your copy, we then get the inclusion sections. Now, attendance figures in here. Attendance is measured normally on every term, and then we usually give you a figure which is after 6 terms or 4 terms. This is 1 term's data, so the only published national data for attendance is for the first term from September to the Christmas. So we've only got comparative data for that term. And you'll see later in the report what else we did around attendance. But for that first term, our attendance continued to be very strong. It continued the picture we've had for a number of years now, where our attendance is stronger than national, better than Outer London, and better than London figures. Our persistent absentees, that's the figure when a child is absent for a considerable amount of their time from school. That's a very worrying figure if it's high. We are lower again than national, lower than Outer London, and lower than London. So it's a very good position to be in. If you look at that by the particular groups of schools, you'll see that our position around persistent absentees for primary and secondary is much better than national. Our position last year we reported around special schools was very high. That has come down in that term, which is a good position to be in. It's still slightly higher than others, but it has come down. So that's a pleasing response, but it is still slightly higher than others. If I move on now to look at what happened during the lockdown, Elizabeth's already said that schools were obviously closed. They were open for vulnerable children and for key workers, and then they were then opened for selective groups of pupils, and that attendance was voluntary. So it's a very different position from the normal position. There is a graph which is quite hard to understand, I confess, which is on page 66, but you can see on page 66, once schools are reopened, the attendance increasing of pupils. There's an interesting pattern there of children not coming to school on Fridays, which is why it goes up and down in little hummocks almost. But that's because attendance was voluntary. The main thing which we did during that period of time during the lockdown was to make sure that children that were vulnerable were attending school. So we ran a special process which is called our COVID CME panel. This is referred to on page 66, and was something we started up based on the normal CME process we have. That's children missing education. So we normally run a panel which looks at all children out of education. We continued to do that during the lockdown, but we also ran this special COVID process where we reviewed all the children open to social care. So we had meetings with every social work manager and reviewed every child that was open to social care to look at their attendance. And you'll see from the graph, which is on page 68, there's a blue line with a series of red dots on it. The red dots were the meetings we had with the social workers. You see a gradual increase in children with who had social workers with their children attending school. It was a challenging situation for lots of families. They were being told that they had to protect their children, and they were open to social care in some cases for being seen as not protecting their children well enough. And yet we were telling them they had to send their children back to school. And they were finding that message a hard message to understand. But a lot of work was done by social workers, talking to families, helping them. There was work done with health as well to convince families that it was safe for their children to go back. And increasingly children did return to school, which was good, because we didn't want those children missing out on education. And you can see that we had an increase from the three groups of panels, that we had 26%, 32% and 92% of those children attending school. That was a good position to be in, and something we reported at the Ofsted in the autumn, which was seen as a very strong process during lockdown to make sure our children were protected. All children that had EHCPs were also had a process in lockdown of doing reviews to make sure those children were safe to be in school or better to be at home. Particularly for our most vulnerable children at Perseid, our head of SENDIS met with Perseid on a weekly basis to review those children to make sure that they were either safe at home or safe in school, and to make sure those children were most protected. There's a reference on page 68 to shielding, which obviously applied to a lot of adults, but also applied to some children. And children that were shielded, a special team was set up to make sure those children were okay and their families were supporting them and education was being supportive to them. That shielding process, again, was something that was set up sort of overnight by officers to make sure that children were well protected. From the 1 terms data that we had, we can see that there were some equalities comparisons we can make. So this is for the first term, not for the COVID times. So the first term's data, and we can see there that our attendance, this is on page 69, our attendance was improved for children with the HCPs, and the overall absence was lower than national and lower than London. So it's a good overall story. Moving on now to page 73. We can look at exclusions. Now, again, exclusions it's a different year. You've got schools not open all the time. You've had a normal autumn term, and then you've got some children in for the first term, and you've got some children in the second term. So there is no we don't know if there's going to be published comparative data, but the picture we have is of the exclusions that we have that have been published so far. So we have a picture where we had no permanent exclusions in primary school again, which has been a pattern for many, many years. We have a secondary school position where there was a big reduction in permanent exclusions. We have a special school position where there were no permanent exclusions. If you look then at fixed term exclusions, you can see on the graph on page 75 that there's a decline in fixed term exclusions. Well, there were less children in schools, so is that part of the story, or was it also the children were coping better? We certainly have some anecdotal feedback from head teachers that some children cope better when there were less children in schools. Children with EHCPs were in schools, vulnerable children were in schools, and some of those children coped very well with the very small classes and a lot of teacher retention that they managed to have at that time. I did look at the pupil groups information on page 76, and although the comparison with the previous year may not be fair because of obviously not that many children were in school, I was interested to see if the disadvantage had increased. There's a concern, obviously, that there might be a bigger disadvantage gap. Well, in fact, it would appear the disadvantage decreased. So the number of free school meals children that were excluded, the percentage difference between the two is lower. The same is the percentage difference between white British and black Caribbean is lower. So the disadvantage seemed to decrease last year, which is very interesting. It would be true, though, still to say that if a child is on free school meals, or a child has an EHCP, or a child has a black Caribbean ethnicity, they have a higher chance of being excluded from school. It is, however, lower than it was in previous years and is lower than elsewhere in London. The last part of the report then goes into our what's called children missing education, elective home education. So elective home education story in this data doesn't quite tell the full story of the year. So if you look at the data on page 80, you'll see a graph there which looks at the numbers, and you'll see that we have 227 children electively home educated, and we previously had 229. So it looked like the year was a similar year to previous years. Well, for part of the year, children weren't being referred to us for being electively home educated because the vast majority of the country were being educated at home. So those children were not being referred through. So what we had was in September, we had some children being referred through. We had no one being referred through for a large part of the year. And then towards the end of the summer term and across the summer, we saw a very, very significant rise in elective home education. And the picture currently is probably a doubling of elective home education from previous years. The main reasons behind that seem to be a big rise in primary school children being electively home educated and children from private schools being electively home educated. So we've seen a very significant rise in those numbers. However, even with a rise in those numbers, we managed to maintain the reviews of children. Those were done over the phone or online, and children were seen in 93% of those online reviews, which was very good. We had less children, less cases being seen as not appropriate. So it's a good process of supporting, but there is a definite increase in elective home education. The last part of the report then is what's called children missing education, which goes from page 86. There's a chart which is on page 87 to 88. So we run a panel which is called Children Missing Education. And on that panel, we review children which are off roll. That means they're not in school at all, and children that are vulnerable. Now, children were off roll. We were very concerned that schools being closed would mean those children would be out of school even longer. Now, children couldn't move around the country, so there were less children moving into the area, but across the year, roughly the same number of children were on the CME panel as previous years. That means there were children still being moved into the area who we had to place in schools, and we had a similar number to do it with. Obviously, it took us longer to do that because schools were closed, but interestingly, we managed to get more children into schools than in previous years. So our closure rate was at a higher rate at 88% than the previous year, which had been 64%. So that's a very good position to be in. For vulnerable children, many of them were there because their attendance was low. Well, if they weren't able to go to school, their attendance remained low and they remained on the panel. So we wanted to review those children when schools reopened again to make sure they went back to school. So we did manage to close more of those cases than previous year, which is across the whole year, which is very good. But obviously they took a lot longer to close because schools were closed and children were not on the panel. Children were not in school. The last part of that I'd like to note to you really is the very, very end of that chart, which is number of children that were open to the youth offending team who were on the panel. And it's a very good story because obviously we're very concerned about young people on orders that might be in youth offending service, youth justice service, and we had no children out of school on the panel in the entire year. And children that were vulnerable, we had 5, which was half the number of the previous year. So a very good story about that particular vulnerable group and making sure that they were in school. Again, the last chart there looks, on page 88, looks at the number of children coming off roll. And again, this is a story that doesn't tell the full story of what happened last year. The number of children that were off rolled that we had to then move to other authorities or they moved away was about 2,227, which is about 400 lower than the previous year. In fact, what happened was when schools fully reopened in September, a large number of those 400 and more were then referred across. So when we look at this next year, we'll see a very significant rise in children being removed from school rolls. The main reasons for that were children that were going abroad, and they were moving house, so their delays for moving house were delayed because of COVID, but significant numbers of children living in the borough have gone abroad and stayed abroad. That's partly because their companies have relocated back to Europe, and partly because some of those children have gone abroad because of the pandemic. So that's the information around inclusion in the report. Thank you.
And I will just wind up, if I may, by referring you to the chapter around the achievements of the children in the virtual school, which is in chapter 5 of the report. This again is quite a different report to normal years because of the lack of data, but I wanted just to be able to refer you to the fact that again the work of the virtual school during the lockdown period was scrutinised by Ofsted during their visit, and the school received praise for that work. They continued to carry out personal education plan meetings, PEP meetings with young people. Those were carried out virtually, and in fact we found that engagement of young people in those PEPs was actually better during this time, again because of some young people feel more comfortable to join a virtual meeting than they would do to join a face-to-face meeting. So some aspects improved, I suppose, really in terms of work, and tracking closely with colleagues in social care to ensure that those children were in the right place, safe, during that first lockdown period during the summer term. Chair, I think that concludes our presentation of the report.
Thank you very much. Before I ask anyone to speak, can I sort of put forward a suggestion, please? For myself, I don't know what everybody else is thinking, but the graphs, could they be in color and probably be in slides? Because I find it very difficult to see what's going where on some of them. And so in future, is it possible to do them that way so that well, it's easier to look at and people learn differently as well?
Chair, we'll absolutely. We've been discussing with colleagues in Democratic Services how we might get them in colour in previous years as well, but there's so much of the report and we will see what we can do.
Sorry, but I realise that and we haven't got money. But if you do them in the book in colour, it costs a lot. If you do a slide where we can see, it will be much cheaper. So if that's possible, that would be appreciated, please.
Of course.
Otherwise, thank you very much. It's very long, and that's why sometimes breaking it up a bit helps a little. Okay, Councillor Makin, I think you want to speak.
Yeah, thank you, Chair. I've got one was the same question really. Can the graphs be in a way that it can be defined if printed in black and white so that we know which line's which? But thank you very much for that report. It was very extensive and very good and covered everything. And all I want to know is where it goes now.
Apologies, Councillor Makin. Sorry, could you repeat that?
Where does the report go now it's been here?
This is where the report lands, Councillor Makin.
Right, so it finishes here.
Well, I should say, of course, also being shared with schools so that they can understand that overview report. It comes to our Attain partnership, our partnership with schools, partnership of schools with us, and it helps to understand priorities and where we're working well.
Right, thank you.
Councillor Henry, please.
Thank you, Chair. And I'd like to thank both Elizabeth and Keith for a very in-depth report. And this question is for Keith. Keith, I notice the absence for, we have 9.9% of absences. And I'd like to find out what investigation has been done in relation to this amount of student being absent, and what support are in place for those students that they start to take more interest, or the parents or children take more interest in education. The next thing is, just want to find out what support are in place for students who are home educated from our borough.
Thank you. So the first one is that 9.9 was the level of persistent absentees for the autumn terms. If I say what we do in general around persistent absentees, so there's a range of things schools can do. Schools, to start with, will want to try and encourage good attendance for all children, and they'll have systems in their schools which encourage good attendance for all children. So that looks at whether the child is encouraged to attend school by praise and by those kinds of things which help children to attend school, and the sorts of things they run in schools like competitions in classes. All those things help to attend good attendance. Once attendance starts dropping down, then schools will identify individual children, and they'll work with education welfare or their own services if they're an academy to try and identify what needs to be put in place to help that child attend well. Now, for a range of children with persistent absence, their issue will be illness. The biggest reason why children are persistently absent is they are ill. And it's about making sure they get proper medical support to find out what the issue is. So, for example, if it's asthma, making sure they're attending the clinic properly, making sure they're going to an asthma clinic, making sure they're getting supported. So there might be support done by school nurses to support working with schools to try and support them. If you have children where there is no medical reason why they're not in school, and there's no other reason why they're not in school, then you're getting into education welfare territory. And that's about where education welfare will support and challenge some families to say that a child should be in school. And we will use meetings with education welfare officers. We'll use penalty warning notices, and we'll issue penalty warnings to families to encourage attendance. And there is good evidence that if you issue a penalty warning notice, that has a good effect on getting children, parents to be focused on that, and parents to get children into school. Some of those cases will be long-term difficult cases where we're even more concerned about whether it's a neglect situation. And then there may be meetings between the school and social care about whether or not the situation that a persistent absence tells us that neglect is occurring. And we may then work with social workers around that. So there'll be children which are persistently absent, which are on what's called our Children Missing Education panel, which we meet monthly. And I meet monthly with the managers of the social care team, and we discuss individual children that have been out of school for a long time. And there's a huge amount of careful work that's done with those families to try and encourage school attendance. Sometimes it takes a very long time, but sometimes there may be very big issues in those families that need to be resolved, and social workers will work very diligently to make sure they work with that family to encourage those children back to school. So that's at the far end of things, but we also start at the other end in trying to reduce the level of PA altogether by making sure school is a fun and happy place to be in and children want to learn there. The second part of your question was about elective home education, and in terms of that, the local authority's responsibility is to make sure that the education is appropriate. We do send information out to families, and there's an awful lot of information out there for families now, because obviously lots of children were educated at home this year, so there is a lot of information out there which supports children to be educated at home, and there's a lot more resources than there were, but we send a pack out to parents, but our job is not to support that home education. That's for the family to do. They've chosen to educate their child. Our job is to make sure that that education is appropriate, and we will then make sure that we have some teachers in Elizabeth's team that will go and work with those families to make sure that that education is appropriate. They'll do a visit, or at the moment an online visit, and they may give advice back to that family about whether or not the education could be supported in that way. They might look at the social skills, they might look at the academic skills of the family and what they're doing, and give advice there, and then they might then revisit again to see whether that's okay the second time round. So as I say, in most cases, the education the family are doing is completely appropriate, and we're finding more that's appropriate, and that may be related to the fact there's more resources out there for families to use than there ever were.
Thank you very much. Anybody else? No. Oh, okay. Councillor Pearce, please.
Yes, thank you. Thank you, Chair. I actually think that what the schools and what the authority have done over the last 15 months is remarkable. And following that, I think this report, there are so many facts and figures here that you can't possibly digest it in the space of the time we have the information. So I'd like to keep my 2 or 3 questions down to very simple. About NEET, on page 42, there's bullet point 2, it says, looking forward, a toolkit and guidance has been produced for measuring what matters. I'd like to know what our local authority and the schools think is most important, what matters. And have we got, because we've done so much good work, are we looking forward to having enough impetus and resources to keep that good work flowing after we get back to normal, for want of a better expression? And the other question is about Ofsted. Now, I know Ofsted has basically come to a dead halt, but they will have to come back. And on page 14, the second bullet point about inspections, it says, long-standing, outstanding judgments to be prepared for inspection. Does that mean, I mean, I want to know what it means, but does it mean that we are going to prioritise the schools that have been without Ofsted longest and have had the same judgment on their reports? For some schools have had the same judgments on reports, 2 or 3 inspections running. Are they taking priority, or is that just a way of wording that we're going to do as much as we can for all. Thank you, Chair.
Councillor Pearce, I will take those questions if I may. So your first question related to page 42 when we referenced measuring what matters. So this is in relation to pupils with SEND. So pupils with special educational needs and disabilities who will not be necessarily making the same progress through the curriculum as their peers. And so we need to measure, use other indicators of measurement to ensure that we understand that they are making progress which is in line with their with what we would expect and our higher expectations, I should say, alongside that. This was toolkit and guidance that was produced with SENCOs in schools, led by colleagues in the Inclusion Service and our SEND inspector. I think schools have I know that schools have found that very useful and will be embedding that use across this year. You also referenced on page 17 the long-standing outstanding the schools with long-standing outstanding judgments. Yes, use of language there. Ofsted have said that they will, so first of all, the government did finally lift the exemption of outstanding schools from routine inspection. We had been expecting it for a long time, but it didn't actually come through until autumn of last year. So we know that outstanding schools will start to be inspected as from September. They are not going to be picked up this term unless they invite Ofsted in. Those are the words. Ofsted are inviting outstanding schools to invite them in. The outstanding schools will not, Ofsted have until 2026, another 5 years to get round all the outstanding schools. They will be prioritising the schools that received an outstanding judgment prior to 2015. And the ones which received outstanding judgments after that date will come a little bit later, but you can hear 5 years to cover all the outstanding schools. Some of our schools, even with relatively long-standing outstanding judgments, may not be inspected for a good number of years. Our support for schools, we have our school improvement strategy. We categorize and offer different levels of support to different schools depending on factors in schools. But for our outstanding schools, we're going to be thinking about how we can offer them more support, either through the Merton Education Partner Programme or through some centrally organised events where outstanding schools can work and learn from each other. Some of these schools haven't been inspected for over 12 years. And so the experience, some of these staff will never have gone through an Ofsted inspection at all. And so the work that we need to do with those schools, or not need to, we have been doing over the past few years in terms of, because as I said, we knew it was coming, has been focusing on getting them to think, okay, this is different. This is you've never been through one of these before. How do we ensure that you're skilled up for the current framework as well?
Okay, thank you very much.
Yeah. Can I ask one, please? Page 36. At the bottom of that phonics list, it says white and black Caribbean. Who are those people? I'm Caribbean and I don't recognize them.
They will be of mixed heritage, so Black Caribbean and white heritage of mixture. It's a category used by the DFE, by the government, and is used also in terms of ascription as part of the school census.
It's a new one on me. I'll have to learn that one. Thank you. And anyone else? No. Okay. Thank you all very much. Okay.
Chair, with quite a few of us had.
Just one second. James has just put his hand up.
Yeah, we've had our hands up since the start of questions.
Somehow. Can I go to James first, please?
Thank you, Chair. So it's an incredibly good report, and it really makes very positive reading. And we've seen this trend now for a number of years, so it's excellent. And congratulations to all officers involved. Chair, I do have one negative comment, which I don't very often make, in fairness to me. I think Elizabeth and Keith are two of the finest officers we have in the whole local authority, and I think Merton's very lucky to have them. But we have had nearly 50 minutes of presentations tonight. We meet so rarely for such little time, and I'm sorry to put the ball in your court, but as chair, there's nowhere else to put it. And I do just want to flag that this is a 2-hour meeting, and we had 50 minutes of presentations. I spent, I mean, unfortunately, those presentations were on things we should have read, and if there's a lack of understanding, which by lay members is very understandable, there's lots of things I don't understand. That can be dealt with by training or by briefing notes, but to use nearly half the meeting to go through things that we should have gone through anyway, and Dagmar's report could easily have been circulated. Chair, I would just like to leave that with you. I'm not very often negative, but I would like to leave that thought with you for future meetings. I spent a long time going through this. I mean, I've got about 8 or 9 comments to make, but I mean, there's barely time for it now. What I Chair, with your permission, what I might do is very briefly run through them and then maybe ask officers, but I can do it very briefly, and maybe ask officers to come back at a future time. Maybe drop me a quick note and copy other panel members. Is that, Chair, is that the right way forward, do you think, just to save time at the moment?
If you're happy with that, I agree, because it was quite long.
No, it is what it is.
Some people yawning, so in that case, it must have been quite long.
Well, I certainly wasn't yawning. It's an excellent report, and as I said, I feel a bit embarrassed that tonight is the night that I've pounced on this, because I think Merton is incredibly lucky to have Elizabeth and Keith. So my comments, and I'm just going to run through them in the hope officers can copy them down and maybe come back in the future. The MEP visits, I saw that there are 2 a year to most schools, but obviously more if they're needed. I mean, if there's any way to increase that, if there's any way, whether we ask the schools to make a greater contribution, but it seems to be such a critical part driving the success. More looking at, and I mentioned this to the director last night, but looking at technology, we've had to use technology so much, personal technology in the last year. Is there a way to embed that in the curriculum? Now we've got the opportunity to. The school standards committee that meets, again, I would just urge, not for the first time, that is, if we can, that we make that more robust. At the end of the day, we are the custodians of taxpayers' money, and we are the employer in most schools and the landlord in most schools. So I just want to leave that comment. I mean, this is building on huge success, I should add. I'm just saying these were my thoughts as I went through. Do we have a volunteers program to get volunteers, parents? Obviously, they have to be checked, I understand that, but volunteers in to help with reading, for example, because again, building on fantastic success, just reading through as a layman, thinking, how can we build on this? We have done work in the past about linking to local employers, work experience visits, and wouldn't it be fantastic if we could? This is a subject I've believed in for 10 years and done some work on, including with some people here tonight. Wouldn't it be great if we could have local kids going to local jobs? I mean, that's and that can begin with perhaps building links with local employers who could sponsor laptops in the classroom maybe and provide work experience. And then perhaps the one thing that would be worth commenting on tonight, I noticed geography and history weren't so strong, and phonics has been addressed. The one thing, Chair, that I'd be grateful just for a little bit of comment on, actually, no, don't worry, I don't need comment tonight, but the support and challenge groups look fantastic. I mean, what a brilliant piece of work that is. And again, if we can, that's something to be built on. So Chair, I made my comment. Thank you for taking that on board. I don't really need answers tonight. I appreciate I've covered quite a lot of ground. It's an amazingly strong and fantastic report, and perhaps if I could get a written reply with comments on what I've said, because I don't think any of them are necessarily very short answers, and copied to the other panel members. And with that, I'm happy to leave it at that, Chair.
Okay, I have a comment, but I'll leave it to Elizabeth and Keith first. But can Haley speak before you come in, please?
Sure, and thank you, Chair. I think James has actually picked up on a couple of my comments from the report, because I think that we have to consider that everybody's should have read the report before the meeting. So I do concur exactly with what James did actually say. In addition, I've got a couple of questions as well, and I think that Elizabeth and Keith are probably used to this line of questioning from me. And by the way, thank you very much, both of you, for an excellent report and for actually presenting the material within there. For a balanced report, particularly presenting it, I'd like to know in terms of what the priorities are in terms of improvements as well. So we talked about in terms of everything, in terms of, it's all very much, aren't we great? And the report does read as if Merton is really great, but there should be some key areas for improvements. And again, I'm happy to take the answers to this as written as well, so in the interest of time. So it'd be really interesting in terms of, so what are the priority areas that, we really do want to focus on, in addition to what we're already doing and what we need to do, but in terms of where we need to kind of pull our socks up and make improvements, at Merton. My other question as well is, and I know that for the time period that this report is for, but I would like to see what the priorities are come September, particularly with what the children have been through over the last, be about 18 months at that point in time. We know that there's going to be gaps. What is going to happen over the summer? I don't think that you need to, essentially will be guidance from the Department for Education, but I'd like to see what the council are actually going to do to help those children who have struggled, in terms of the attainments. Where do we know there's gaps, and what's the council actually going to do to help those schools, because the schools will know where the gaps are in order to help those children. So therefore, you're not looking at this report further down the line and the whole national average has gone down and Merton's gone down as well, because of this time period that everybody's had to go through at this point. So I would just like to know what you anticipate doing for the future too. But again, I'm happy to have that in a written response.
Chair, may I just clarify something with Councillor Ormerod, if I may? Yeah. In terms of the areas for improvement, I referred councillors, because those are on pages 14 and 15.
Yeah, I did.
Are you looking for sort of the really key ones that we see as the most important?
Yes, that's right. Yeah, because I have read through that, but I still didn't see, and in terms of where you actually wanted to, I'm actually even on those pages that you've just referenced, to be fair. But it's just in terms of, I'd like to see, this is our like top 5 that we've done well, and this is our top 5 which are our absolute focus, and that's what we're going to come to you this time next year and tell you what's actually happened with that.
Okay, thank you. Keith and Elizabeth, whatever it is that you're going to write, can you make sure to share it among the whole group, please?
Of course.
And not just some, because I know sometimes people ask and it looks as if it's just 1 or 2 people. And finally, the report was excellent, but it was very, very long. And I know that we're not finishing until after 10, but we have lots of other things going on as well. And so, as I asked, and I think others have mentioned, if in the future we can have some of the figures put in graphs and probably show on the screen or share on the screen. We might not be on Zoom, but we can do it in other ways as we used to. And that actually, for me, I'm an active learner, and so I learn by seeing colors and drawings and not just words. And they're there, but because the colors weren't showing up, and I understand that there's money as a problem, but we'll have to think of some other way of doing it, I think. Thank you. Carla, are you putting your hand up, or you okay? No, okay. Right, okay, thank you both very much. And now we're going to do corporate parenting.
Thank you, Chair. So, I mean, so to round up on the other one, we'll take that all on board. I think probably Keith and Elizabeth, in fairness, presented in the way that they have been requested to present previously on the annual reports, and it is once a year that we do this report, but we take it all on board and we can address that for the next year's report. So we have David Michaels is with us and will do the introduction to this report. So David is our Head of Children in Care and Resources, and John Walsh is also here, who's the interim head whose brief covers the care leaving team. Just to note though, Chair, John is on call this evening, so if he suddenly disappears, Elle and David will pick up anything that relates to his part of the report.
Good evening, Chair, and good evening, colleagues. So yes, I'll be quick. There's a cover report for this report. It's a very long report, and it's basically a summary of everything we do for our children in care and care experienced young people over the period of the 2019-2020 reporting year. So it's quite a long time ago what we're talking about. The reason for that lateness, some of you will be curious about, is to align ourselves with the statutory, the governmental national reporting, to make sure we can do benchmark, which comes out very late in the year, around November, December time. The purpose of this report is very much for the corporate parenting board to help them fill their duty as a corporate parent, to know what's going on and to monitor and scrutinize what we're doing. And it's been to corporate parenting board and in February, and now it's coming here and it will be published. So we just pulled out a few things in the cover. Yeah, mainly the number of children in Merton Children in Care has remained stable for the last 5 years, which is different from the national picture which we're seeing, but very in line with what we're seeing in London. Conversely, the proportion of unaccompanied asylum seekers has been going up, and there's an upward trajectory, which is somewhat balanced out over the course of the pandemic. Children on care from the Black British community is higher. It's disproportionate. It's another example of systemic racism within society and compounding and factors with that. Court proceedings, 48 children, which was a significant decrease from the previous year. We're in court proceedings, but positively, only 11 of these children remained within their immediate family, and extended family networks were permanent. So that's a real shout out for what we're trying to achieve. The regionalisation of adoption went through with the formation of the Adopt London South, and we successfully had 6 children adopted during that year. Performance around foster carers was low in comparison to previous years, and now we're trialling a digital campaign, which we hopefully see the benefits of soon. And we held our first fostering conference in February, just before the pandemic. It was absolutely fantastic. It was a big success, a real big turnout, and possibly for our older children approaching adulthood, we really did some work around strengthening our planning and support for our young people around transitioning by focusing on the pathway planning. So that's a real, it's a big report, but if I could just open it up to questions, and John, Carl, and myself will do our best to answer them for you.
You're on mute, Brenda. You're on mute, Brenda.
Sorry. James, anyone else apart from James?
Thank you.
Thank you. Doesn't seem to be at the moment. Go ahead then, James.
Thank you, Chair. Thank you very much. Like the last report, a lot of positive stuff in here, so thank you. My questions are on page 7 of the supplementary agenda pack. And the first substantive paragraph, the one that begins with progress, it refers to the service and the virtual school continue to explore new opportunities for alternative training routes, apprenticeships and work experience. And so my first question is, would it be possible just to have a little bit more comment on that? But sounds exciting. And then generally on page 7, there is obviously discussion on independence for care leavers. And I just wondered how this related back to there's no mention that I could see of the task group that this panel set up a little while ago, but it may be that work is embedded in this report, but just not named as such. So it was just one question for a bit more information, and the second a question for clarification. Thank you.
Sorry, can you just repeat that question you want me to answer about care leavers?
So there's same page 7 of the supplementary pack. The action point 4 is talking about care leavers. There's a lot of good information in there, but there's no reference to the task group that this panel set up on care leavers a little while ago. And I just wondered if I wanted to make sure that the work of that panel was embedded in what we're reading, the work of that task group. It doesn't, of course, mean that the task group has to be mentioned, but I wanted to make sure that all that work hadn't been totally ignored in what we're reading tonight, that's all. So more a point of clarification is the second one.
Okay.
Thanks.
I'd need to go away and have a look at what that task group has been doing and where it fits in. One of the things, I came into this service from mid-December, so I need to go and clarify before I respond to you. What I would say is we actively follow through on plans. We don't lose traction, but before I give you a clear response, I want to go and have a look.
That's fine, thank you. And then that's absolutely fine. And then my first point was the paragraph above. Did you get that? About
supporting progress in training and employment via the virtual school.
No, this was to say to explore new opportunities. So it sounds exciting. It was just to get a little bit of a flavour as to what those new opportunities were or are.
Okay, and that's the one you wanted.
Or might be. Yeah.
That's the one you wanted us to go away and come back to you on.
No, that's the one just for you to give a little bit more comment this evening on what those new opportunities are.
Yeah, could I just invite Elizabeth Fitzpatrick to comment in response to Councillor Holmes's question, because I know that Elizabeth is well cited on this.
Thank you, Elle. So the virtual school sits in my service. We are lucky enough to have in the virtual school an EAT worker. This is a worker who works with our young people who are vulnerable of becoming NEET, or who actually become NEET after leaving their school at 16. The work that she does is incredibly joined up with social workers. She is always liaising closely with social workers, personal assistants, to look out for those new opportunities. And key to that is also the links into the My Futures team. And the work that they are doing to support young people, and the work that colleagues in our commissioning team are doing to find more of these opportunities for apprenticeships, for different routes into employment, training and education. Councillor Holmes, I suspect I'm not being as specific enough as you would like me to be, but it's about the persistence of that EAT worker working with our social work colleagues, and also My Futures teams and commissioning teams, and recognising really that for many of these young people, I think in a much more clear-sighted way, that such things as apprenticeships are particularly useful for some of our young people who are in care or leaving care.
Okay, thank you very much. Thank you, Chair.
Thank you. Councillor Macon, did you want to speak?
Yes, I do. Thank you. Thank you for this report. I found it quite confusing sometimes to read. I had to reread a couple of paragraphs because I didn't quite understand what they said. Particularly paragraph on page 37. No, well, page. I've got the paragraph in the paragraph on page 34. The paragraph after the table, I didn't understand what that meant. And there's a word in there that I've never come across before. I think it's a spelling one, and that was at the bottom. You've got the word ideation in the middle of a sentence about linked to levels of suicidal ideation. Don't know what that means. And the paragraph before that is the one that I didn't understand because it seemed to be all mixed up. I've read it a few times. Also, could we have a jargon? Could we have a glossary on the front so that we know what IROs stand for, etc. And could you tell me what C card is on page 35? Thank you.
I don't. Okay, can I just take one more question?
Okay.
Henry.
Thank you, Chair. Can you hear me?
Yep.
Right. Okay. For the two officers, not Jane, I understand that during the pandemic, there are a lot of young people lost their family or friends or colleague. I haven't seen anywhere any support have been put in place or talk about support, what has been put in place for those young people. Can anyone explain to me, I mean, you know, why it hasn't been in a report and, you know, how support have been put in place for those young people, especially those in the teenagers who are going into high school, that are going on to university. Thank you.
I'll come to you in a minute, but Monsieur want to ask a question.
Thank you, Chair. Thanks, David, for the comprehensive report. It is really appreciated. I've got two questions. Court proceedings were issued for 48 children, which was really a significant decrease from the previous reporting year. What is the main reason behind this decrease? And my second question is, what actions have so far been taken to increase the performance regarding the recruitment of foster carers? Thank you.
Thank you very much. Elle, are you going? I'm not sure who's answering this question.
Yeah, can I suggest Elle starts and then she'll hand over to the other officers where she needs to.
Thank you.
Yeah, so I just want to give a response to the question that Councillor Henry asked about the support for children where they've experienced bereavement or a loss of a parent around COVID-19 and why that doesn't appear in this report. So I just want to clarify the date that this report covers. So this is a report that is coming to this panel a year after the end of the year in which the activity happened. So the report covers from April 2019 until March 2020. So we weren't in a COVID pandemic during the period of time that this report covers, which is why there's no mention in this report about COVID-19 or about the support that would be offered to children in our care or our care experienced young people were they to suffer a bereavement. So we would see that information come in the subsequent corporate parenting reports. I just thought it would be helpful just to clarify why that doesn't appear in this report. In relation to the word ideation, so suicidal ideation is the term that's used for individuals who have suicidal thoughts, where they're thinking about committing suicide or taking their life. But I take on board, Councillor Makin, your comments about writing the report in a way that is easily accessible, that the language is easily accessible. So we take on board that feedback. So if I can pass over, first of all, to David in relation to the decrease of children in care proceedings, and then after David has given his response, if John could just pick up and explain what C cards are and how they're used. Thanks, David.
Yes, thank you for the question. So yeah, it's a decrease from, so we had 63 children in the previous year down to 48, and that corresponded with 31 families to 24 families that we're reporting on. So it's difficult to make conclusions around sort of why there is a decrease. I would like to suggest that it's because of our practice model, and obviously our firm belief is that we're only using our statutory duties absolutely to our ethos is to keep families in their homes and to have really robust early help work and really robust child protection work, and we're staying away from the courts unless we absolutely have to. We absolutely believe that actually we need to go into proceedings and subject these children and their families to this because we believe that to keep these children safe, we need to act and use those powers. So keep in mind that these are small numbers, but same with children coming into care being steady. It's because of that belief that we're trying to keep children safe within their homes. And the second point you made was around the improvement of foster carers. I'm assuming you're talking about recruitment of foster carers. I'm glad that I can say that the following year, which is a report that we have improved, got 13, which is the largest number of that we've had in the last 5 years. And what we're doing, there was a part of the pandemic that might have had something to do with that and recruitment. We were using a lot of rallying banners. We had a lot of intel to tell us that actually people driving around the borough and seeing banners up, the banners that you might have seen going into the Civic Centre that were up in front of the Civic Centre were very successful. And so we put them in the parks last summer. We put them up around, so thinking that, okay, people aren't going into the Civic Centre, but where are they going? We still don't have data to know how successful they were, but they have improved. We have invested for the first time in a digital campaign, as I mentioned, and that started around sort of May last year. It's difficult to, once again, to tell the impact of that at this early stage in relation to success. What we know about fostering recruitment is it's very much a drip feed. We've got to plant the seed in someone's head and they've got to see it over and over again, and until they get to the stage where actually coming to the website or calling us up and having a conversation. And even then, it's a long time between that sort of initial conversation to actually being approved as a foster care. It's a very the journey of a fostering becoming a foster carer is quite long and exhaustive, because we need to get the absolute right people with the right motivations to care for our children. So I'm hoping that in the year to come, we're going to see the impact of that drip feeding through a digital campaign of more sort of phone calls and inquiries coming in, and more home visits, more assessments starting, and in the outcome, more foster care has been improved.
Thank you. Thank you.
Thank you very much for that. I think Omar Bush and then Carl Quillam, please.
Thank you very much, Chair. And thank you very much for the report, which once again is very detailed and put together. My question relates to page 13 in regards to the ethnic breakdown of children in care and the Asian ethnicity that are underrepresented. Are you able to provide more information on why they are underrepresented? Because I know the information that's been provided in there is generic to a certain extent. So any additional information you could provide would be appreciated.
It's a difficult one, because for the ethnicity we are speculating. Obviously seeing there that we reported around because there is a overrepresentation of Black Caribbean and Black communities, and there's an underrepresentation of some Asian communities. And as sort of mentioned, that might have something to do with cultures and the willingness to report of what's going on, and some cultures to keep things within their family and try to sort things out within their own family resources. Definitely with the overrepresentation, I think there's a lot of obviously knowledge, especially with this past year. It's been really in the forefront of the press around systemic disadvantage and systemic racism and how that impacts upon individuals and families. And I think this is a manifestation of that systemic disadvantage that some of our communities experience within society. Around the age of children coming into care, so I might quickly go to the report, but it's disproportionate to the older children. We know that older children are coming to their care, and predominantly that has something to do with our separated children, our unaccompanied asylum-seeking children. That also has a lot to do with the emphasis that we have, rightful emphasis that we have on protecting children against contextual harm, the rise of that's going on, to make sure that we're not just worrying about risk within the family home, but also risk within the community. Sometimes we have to act to keep children safe. So we're working a lot more with the youth justice and around how to do that. And also it sort of links into the previous question from the councillor around the court proceedings. I suppose our emphasis on permanence and to make sure that we're achieving permanence wherever possible in family homes and not actually bringing into children in our care. So when we get a child, or a baby, very young children, we're really trying very hard to exhaust all family options. And if we can't succeed in doing that, of course, we're looking at adoption, and we're trying to keep children out of care. That's obviously a lot more difficult with older children and teenagers coming into care for different reasons.
Thank you, David. Just one additional comment in relation to the underrepresentation. What's the council then doing to reduce that underrepresentation? Because my fear is that if they're underrepresented, then does that mean that they're being missed out and actually they should be within those figures of within our care?
I suppose that links into our sort of early help strategies and within our schools, and making sure that we've got sort of lots of eyes in our house, how our system works. I don't think that we've found any information to suggest that we are missing anyone, and definitely our systems within our schools. Children are not health visitors, midwives. They're going around, they're seeing these families, they're talking. So yeah, and like I said, I have to say that it is speculation around what we're doing, but we do have systems in place within our whole structure and our systems to make sure that children are being safe at sort of early help level and are receiving the supports they need. I don't know if any of my colleagues want to sort of add to that. Al, let's see. Oh, sorry, Chair.
Thank you.
Yes, if you want to, please.
Yeah, so I think there are two approaches really to underrepresentation. So the first is, as David has explained, thinking about our early help strategy and the work that we do with our schools around raising awareness around safeguarding and particular groups, the work that we do in the Safeguarding Children's Partnership. But there are also significant cultural differences between communities and the way in which families operate, and so sometimes the underrepresentation can arise because culturally families operate in very different ways and may operate as larger groups and may operate in a way actually that as social care services would intervene to hold kind of family network meetings with families to bring nuclear and extended families together to look at how together they might use their resources to help to improve the safety of a child or to care for a child if parents aren't able to do that. Some cultures within our community do that as part of their family functioning, and they don't therefore need the input of statutory services to help them to do that. So there is a balance between making sure that underrepresented individuals, that professional networks are aware of those, so that they can make sure that they are providing information and reaching out where needed. But we also do need to recognise some of the resources and the values of families from different communities and different who've got different cultural backgrounds, and recognise that some of those families and communities will operate in safe and different ways.
Thank you. Right. Oh gosh, sorry.
Chair, I think John had a part of a question to answer as well.
The question I was asked is, what is a C card? A C card is part of the package of support, and it's also training for young people from mid-teens to mid-20s around sexual health and access to not just information, but items such as condoms, around information around sexually transmitted diseases. It's something equally that we commission as part of the package to train people on. So we don't just support the young people with this and provide materials. It's a card, literally, that is a C card that's operated across a number of local authorities, but equally the services provided train professionals and people up to give that advice to young people that they're working with.
Did that answer your question, Russell? Right, thank you. Right, I think we're sort of backtracking a bit. Carl, before we come on to you, I don't know if I heard Mansour's question answered. Did you feel as if your questions were answered? Can you undo yourself, please? Mansour? Okay. Well, in that case, we move on until we get there. Carl, please.
It was actually to go back to the issue of foster carers. You talked a bit about recruitment. I wondered if you could talk a bit more about what we do around retention. I know in the report you talk about the Mockingbird family model. I wondered if that has a big element about trying to help. I mean, it sounds like a really good model. Is that a big element of that about trying to help retention? And is there anything else that we do to kind of help retain foster carers over the longer term?
Yeah, I mean, definitely we want that to help the retention. We're having our soft launch of it on Friday. And coincidentally, I was talking to our recruitment team today, and they've told us that they've had a couple of inquiries because they've seen sort of Bird on there, which is showing that that's being positive already. Definitely within our retention of foster carers has been a strength of ours. We've always had a very strong foster community, which is really positive. And yeah, it's the anecdotal feedback operationally from even IFA carers has been positive around the support that our children's team give our children in their care, and we've had people contact us around that. So I think the support that they receive, very proud of my supervising social worker team, and the support that they receive is of a high standard. And what we know is word of mouth around fostering is very important. Many foster carers come into it, know somebody that does foster, and so having a good reputation as an agency that provides good support and good training to foster carers is essential to achieving good retention, of course. Yeah, in times when we do have foster carers that are unable to retain, sometimes once again anecdotal, it's around sort of not enough need for the age groups that they want to foster, and so our sufficiency strategy is very much we're looking for foster carers of older children, of teenagers, for brother and sister groups, for children with more complex needs, behavioural needs, and mother and baby foster placements, which are sort of harder to find. Yeah, and once the fostering conference, which we alluded to, then I think there's a real big push, I think, from me, definitely with our service, to include them a lot more in our service and our thinking with our social workers. So recently we had life story work training, which they came to a full day, and the feedback from that was marvelous, alongside our social workers. And events like the fostering conference, where everyone comes together, learn together and celebrate together is part of growing and nurturing that community, which is really important for foster carers. They're the type of people that they love communities. They love caring. Obviously, to become a foster carer, you have to be kind of a very special person that is social and loves that community. Does that answer your question?
Definitely, yeah. Thanks very much.
Thank you, David. But before you go, Elle had put her hands up. She wants to add something, I think.
Yes, I just wanted to add to David's very comprehensive list around the support and the community that we create for our foster carers, but also just to say that what is really important for foster carers and also for our children and helps with retention is carefully matching the right children to the right foster carer, because as we all know in our life, the more success that you have, the more confident you feel, and then the more successful and the more able you feel to undertake the next challenge. So that's why actually our assessment, our recruitment and assessment process is as intensive as it is, to make sure that carers are well prepared and well trained for appropriately caring for the children that we look after. But also about us making sure that we match those children very well, so that we have success for children and carers, and that they then want to continue to care for more children as they go through their journey as foster carers. So it's not just the case that you can recruit a foster carer and they can care for any child. There is a matching process that we use as well to try to support our retention.
Have I missed anyone? No, okay. Now to ask if we can shorten some of the questions, because we're at 9 o'clock and we still have a bit to go yet. Right. We just looked at corporate parenting, and I think I'm right in saying that Merton Safeguarding Board is the next bit with Carl.
Yes, Chair, and we need to do the departmental update at some point, but we can do that after this next item. Could I ask before Carl does the corporate parenting report, if you're happy, Chair, that David, Keith, Elizabeth and John, who finished their presentations and questions, could leave the meeting now, if that's okay?
Yeah.
Sorry. Yes, you can go if you finish and want to go home.
Yes, you're very welcome to stay, obviously, I'm sure.
And in fact, it's not going home, is it? You're probably home anyway. Yeah.
Thank you.
Thank you very much. Okay, good night.
Thank you.
Okay. So, Carl now, please.
Thank you, Chair, and good evening, everyone. A very brief introduction to the report, which in itself is shorter than usual. This is the annual report for the financial year 1920. So similarly to the corporate parenting report, this is it's a year ago since the year ended. It is slightly later than usual. We normally aim to produce it towards the end of the calendar year, but we have had one or two staffing issues, and we had to wait for some data to come through for it to complete. The Merton Safeguarding Children Partnership is a statutory partnership, and it's required by statute to produce a summary of its activity on a 12-monthly basis, and this is what you have in front of you for the financial year 1920. Last year, the executive group, which oversees the Safeguarding Partnership, asked for the annual report to be much more succinct and much more focused around the priorities that the MSCP is trying to achieve, and that is what you have in front of you. A key focus in the year 1920 was reflecting the changes that were ushered in statutes to the partnership arrangements, which meant that it was in many ways a year characterised by a change in process and trying to get used to the new ways of working. At the same time, we also, as part of that, saw a change of chair with the resignation of, or the stepping down rather of Keith Makin after a long period as independent chair. But that didn't stop us from focusing on key business, and particularly a focus on our early help reforms and the leadership that the MSCP is required to do by statute was a key feature of the year 1920, as well as a focus on some contextual safeguarding and thinking of particularly child sexual exploitation in a wider context of criminal exploitation and other forms of exploitation, including radicalization. I'll stop there really, and hoping that people have read the report. The last thing for me to say would be that the next steps for this report is that it is customarily uploaded on the Merton Safeguarding Children Partnership website, and that is happening imminently, having already received the sign-off from the Executive Partnership, which constitutes the local authority, police and health colleagues.
Right, okay, thanks. Can I take it that where it said draft is no longer draft then?
So that's absolutely right. At the time of sending it to this committee, I had to still leave the draft watermark in because it wasn't actually on the website. So I wasn't able to, for instance, provide a link. So that is why I took the decision to leave it on as draft. It is not quite uploaded yet. I think it's literally in the next couple of days.
Right, thank you. Any questions? Oh. I think everybody is happy with this one.
Oh,
okay,
I can see a hand, Chair. I think a hand just went up.
Where's that hand?
Councillor
It's Hayley.
Yeah.
Oh, sorry, Hayley. I don't
That's
know
okay.
why
It just went up. Don't
Go
worry.
ahead. Go ahead.
Yeah. Carl, thank you very much for the report. You mentioned that there were some resourcing issues. Is that something that's actually being resolved now?
Yes, absolutely. This was part of a restructure, and absolutely is resolved. It was a short-term issue that we have absolutely resolved. Yes.
Okay. And how have things moved since the timeline towards the end of the report since then, in terms particularly with the subject matter here?
So basically, so your question is how have things progressed in the last year, basically in the last financial year during COVID?
Yeah.
Okay. Okay, where to start? So in the last financial year, we had a new chair start and subsequently leave due to personal reasons. So we're back in the sort of situation where we're trying to recruit an independent chair to act as
you mentioned that. Yeah.
But we have no, so this is so after Keith, we had someone start in the last financial year. It's not covered in this report, but so over the last year, someone started and then has subsequently already left. Then we had the appointment of an independent scrutineer who's provided an external, as part of the new arrangements, an external pair of eyes on some of our activity. Some of the key successes over the last financial year have been a focus on some of the multi-agency safeguarding arrangements during COVID. So the partnership acted as a way to escalate particular issues around health visiting of newborns, for instance. There was an arena where we looked at making changes to that during the COVID pandemic. We were able to oversee the development and launch of a draft early help strategy that has been consulted on, and we're just in the process of getting the feedback for that. We've also refreshed our contextual safeguarding strategy. At the same time, the Safeguarding Partnership oversaw a review into 4 serious incidents that were some of which were notified to the DFE and some of which were internal learning reviews. These are typically very resource intensive pieces of activity, very important pieces of activity, because it is the way in which as a partnership we can look at how we learn from practice, both where things have maybe how we as a partnership can learn from where things have where things need improving potentially, or indeed where we can build on good practice. So that's giving you a bit of a whistle stop to it. Absolutely, in COVID, a focus on domestic violence and abuse, with a new focus and an introduction of a subgroup structure, specifically looking at domestic abuse and as part in that context, thinking about safeguarding as a on a family unit, the so-called think family approach. So those would be just some of the things that immediately spring to mind, and I don't know if Jane or Elle, as members of the exec group, what had anything that I missed? Without also just to say that we ran 2 full board meetings, so this is almost event-like get-togethers with over 40 practitioners, which needs significant planning, and we were able to, for instance, discuss some of the findings from the learning reviews, disseminate the learning, and embed that into practice using that way, and running a training program during the COVID period that we shifted from face-to-face to online, so that practitioners across the multi-agency partnership can still access high-quality safeguarding training. I'll stop there and just ask if there's anything else from Jane or Elle to.
So if I just interject into there as well,
Of course,
I think
please
that we pretty much all know in terms of, because obviously children have been at home, and particularly for those early intervention, a lot of that actually comes about from school as well. So how has any early intervention, or how have you been made aware of domestic abuse over the last 12 months, so to speak? And are there children who we are potentially not aware of yet? So where are the reports coming from? Is this from neighbours? Is it from just people who visualise this? I mean, that's what I'm not really sure about, particularly what's been happening more recently.
Elle, do you want to take that from what you're seeing at in the front door?
Sorry, was having difficulty unmuting. Apologies. We are seeing an increase in not in necessarily in presentations to us, but we are seeing an increase in the severity of those presentations to us, where we've got much more serious concerns about what might be happening in families, which is why, as you'll see in our departmental update later on, we've got an increase in children with child in need plans and children with child protection plans. There are a range of reasons for that increase. We have always had relatively high percentages of children where there are concerns about domestic abuse, concerns about alcohol or substance misuse, and concerns about parental mental health, and that has continued to be a feature during the COVID-19 period, but it was also a feature and disproportionately represented prior to the pandemic as well. So one of our hypotheses around the impact of COVID-19 is that actually because we had a high prevalence of families where issues around mental health, domestic abuse, substance and alcohol misuse were coming into our statutory social care system, those are many of the issues that we know are exacerbated by lockdown or by the pressure and the stress that COVID has caused. We've actually commissioned an internal review of our children who are on child protection plans at the moment, so that we can better understand the underpinning factors that are at play and are leading to that increase in our child protection plans.
Okay, just one final question, if I may. Is now that children are back in school, do you think there's probably maybe an increase in cases because of what teachers actually recognise, because that early intervention or that recognition has not been able to take place so far? And in addition to that, how are you aware of the newborns?
Okay, so there's 2 parts to that. So yes, during the last year, when we look back at the periods of lockdown, what we see is an increase in activity when children either come out of the lockdown or are going back into school settings. However, we do currently have just short of 200 additional children in the system, and that's taken place over the previous 12-month period, and we're currently seeing an uptick in the number of referrals to social care since children have been back to school. So in March we started to see an uptick in referrals. So some of it is because when children go back to school, they are obviously sharing things with trusted adults and their teachers. But we were also, even when schools were closed, we had, for example, a higher ratio of information shared with us about concerns for children from police. So it didn't stop just because children weren't in school, although there were some lower levels.
Okay, thank you, Elle. Thank you, Chair. Chair, you're on mute again.
Got a question
There you
from Councillor Foley.
Thank you, Chair. Elle, sorry, if I can just ask you, while you get a sip and refresh yourself, you mentioned the uptick when the schools returned, which I think I agree, one can expect that. Is it something that can be managed? Is that uptick, well, I know you will manage, but is it, do you have any concerns that might become unmanageable? I know it's a little bit too early to say because COVID is new to us and now the schools are going back, but we keep hearing, and some of the young people I know have found it a strain coping with. But yeah, that's my question. You'll be able to fill in the blanks.
Thank you, Councillor Foley. So I don't have a crystal ball. I would love to have a crystal ball, but I don't have a crystal ball. However, what we are seeing, as I said, is that we do have 200, just short of 200 additional children in the system. So we have already, and I gave an update to this at, I think it was the February scrutiny panel, that we'd been successful in securing some interim short-term funding to look at establishing an additional team of social workers to create some additional social work capacity, because we do have that higher level of work in the system. So if I can give you a kind of an explanation of, most of our social workers would work with between 12 and 18 families, depending on which part of the system they work in. And so if you've got just short of 200 additional children in your system, then you can see that we would need 9 or 10, 11 additional social workers to be able to safely absorb that work. So that short-term funding that we are using at the moment and that is still in place, it is very likely that we will need to put forward a business case to extend that funding, because we're not currently seeing a reduction in the number of those additional children in the system. We're also in a very fortunate position in that in the summer of last year, we were successful in being awarded a DFE grant to pilot a social workers in schools project, which through the What Works Centre, the Department for Education are funding. And that project provides for us 6 social workers in Merton schools. We are also maximising the capacity within that pilot for those social workers to also be working with additional children. And had we not secured that funding, the temporary funding that we've secured internally from the council, we would have to be requesting double the amount of that short-term funding if we didn't have that social workers in schools project. We are going to need to monitor very carefully that uptick in the number of children being referred to us in March, because the system is already beyond its established capacity, which is why we have this additional resource. And if that uptick were to continue for a period of time, then we would again need to be thinking about expanding the current business case for some additional resource, whether that additional resource was additional social work resource, or whether, as we are hypothesising and we are looking to our internal review to give us some more information, whether there's an element that we're working with some children for longer or at slightly lower levels of need because there has been lockdown and restrictions in the wider children's partnership around some of that early intervention that families might have been able to access. We might need to look at how we can support more families at that level, if in fact that is what that review identifies, and we think that that would be an effective and alternative way of helping those children and families. So to answer your question in terms of do we think there's some more? Yes, we probably think that there is some more. Do we think it's going to go significantly higher? I would hope not. But do I think that this is going to be over within a couple of months? No, I think we are probably looking at those higher numbers of children in our system in terms of being able to work through those issues with children and families through plans with our partners. I think we're probably looking at least another 9 to 12 months. It may be more than that.
Elle, thank you for a comprehensive answer, and sounds like you've got your finger on the pulse. Thank you very much. Thank you, Chair.
Thank you very much. I haven't seen any more hands up. I haven't missed anyone, but I want to ask something probably quite different. I was thinking of the staff and how they're coping. I'm wondering if you've got enough CPD in place, and also thinking of the well-being of the staff. What are you doing about that? I don't know, anyone can answer that.
I wonder whether this is something for the departmental update, Jane,
yes,
because that's a council internal kind of, given that we've got council staff, it's probably best to sort of focus on that.
Well, that's where we're going next anyway.
Yeah, it is, yes. Rather than the MSCP, you're absolutely right.
So, Jane, are you going to do that?
So I'm going to start off. So Stella, if you could share, we've just got a couple of slides, Chair. So if you remember, we agreed during this COVID period, we do the departmental update. Not those slides, Stella. Sorry, can you do the ones that there's just 3 slides that I sent over just before the meeting. So we agreed during this COVID period to do the update via slides, Chair. So we've just got a couple today, and I think Elle probably has covered most of what she had in her slides, but she will certainly, I think, touch on. She will certainly touch on what she's doing sort of more generally to support the social work staff. So can I go to the second slide, please, Stella? Okay, so I just wanted to do a couple of updates from my perspective. I thought it'd be helpful for the panel to know what's happening around the senior management team update. So obviously, since we last met, you're all aware we've appointed a new director of children's schools and families, and I officially took over that post yesterday. And we've also got interim arrangements in place to backfill the assistant director for education and early help. So Nick Wilson, who is the interim, started on Monday, and will be with us until such time as we have appointed and the new assistant director for education and early help starts. Everyone on the panel will be aware from the full council meeting we had that also Elle, our Assistant Director for Children's Social Care and Youth Inclusion, is moving on from Merton. And so we are going out to recruitment for both of those permanent Assistant Director posts together. And we have appointed Hayes as the partner we're going to work with for that recruitment campaign. So having a meeting about that tomorrow, Chair, so that's imminently underway, and we'll keep everybody updated with that timetable. Then the other sort of departmental updates. So we had a notification last Friday, be the Friday before now, about our Youth Justice Service inspections. So they are coming in. HMIP inspection is starting on the 17th of May, and they'll be with us for 5 days. But as you can imagine, there's quite a lot of work that needs to be done beforehand to prepare all the documents, to make sure they have everything they need and all the data they need. So we're currently working hard on that. We also, I think we flagged up the last time we came that we were going to be doing a consultation around a restructure to the Children's Social Care and Youth Inclusion Division, and that commenced on the 29th of March. So that is in a consultation phase. So at this point, we're discussing with staff and getting feedback on that consultation, and then we'll consider all of that before deciding on the way forward. I just wanted to mention there's quite a lot of work going on around our transformation and recovery programme, and suggesting that perhaps we bring that in a report to the next overview and scrutiny panel, because I think that the panel would be interested to know all the work that we're doing, and that includes a whole range of things from the DSG recovery plan, a short breaks review of our sort of accommodation strategy for our children in care and care leavers, and our mosaic repair work are just some of the things, a flavour of that. So we will bring that more fully to the panel at the next meeting. I'm going to skip over the schools returns update because I think you've pretty much had that covered for you. Holiday and food programmes, just to let you know, that was successfully run over Easter. We had 500 children across a number of different settings. We were visited by the DfE to review what was happening, and that all went really well and was very positive feedback. And at this point, planning that programme for the summer, so that's for our vulnerable children and children on free school meals. The early help strategy has been mentioned. The consultation on that is now finished. That's an MSCP piece of work, but I think again it would be of interest to this panel, and so I suggest we bring the outcomes of that just for information to the next panel, so the panel are aware. And then I just wanted to just update, because at the last meeting there was obviously quite a sort of in-depth discussion around what we were thinking about around Lavender Nursery and the Merton medical provision. So we went after the panel meeting and met with a group of the parents from the nursery, and we had quite extensive feedback on that consultation from parents at the nursery, parents who access the Merton Medical Education Service, and also a broad range of professionals. So where we had thought that we would go back to the Council's Cabinet in March, actually there was a number of things for us to think about and analyse within those responses. So we are working through those and intending to take that back, hoping to complete that piece of work to go to Cabinet in July. So those are my key updates. If we go to the next slide, Stella, then I think Elle has covered quite a lot of this, but she may just want to touch on anything that she thinks wasn't covered in her previous answer.
Yeah, so I think I've covered the demand section, but in relation to the management actions and the impact on staff, which Councillor Fraser raised, we are continuing our sharp focus on recruiting additional social workers, both for any vacant posts and also to fill any of the interim posts where we've got the agreed funding. That is a challenge in the Pan-London context, and all local authorities across London are looking for additional social workers. Many authorities are experiencing the same pressures that we are here in Merton, but we are continuing with our very sharp focus on that. And in terms of staff well-being, what social workers need us to do is to provide sufficient social workers so that actually caseloads for them are manageable. We've also used some of the additional funds to secure some additional management capacity, both to provide additional support to our social workers in managing the children, but also to provide some additional management oversight for that casework as well, because obviously where we have more children in the system and require more social workers, we also need more management capacity to make sure that all of that work and intervention happens in a timely and safe way. As I mentioned, we're maximising the capacity of the social workers in schools projects, and I'm pleased to say that the Department for Education let us know a couple of weeks ago that they are now extending the funding for that pilot until March 2022. So we're very relieved about that. I mentioned that we've initiated an internal review to help us identify some opportunities, perhaps to be able to support some of those increased number of children with plans in alternative ways, so that we can look at reducing the number of children who need that level of statutory intervention. And as I mentioned, if we need to extend the business case, which seems extremely likely, both in duration and potentially in terms of the amount of additional funding we need, then we will obviously put that forward so that we make sure that we have a service that is operating safely and is also taking regard of our staff's welfare. In addition to all of that, myself and the senior leadership team are engaging frequently with our staff. So I hold a fortnightly keeping in touch meeting, which everybody is welcome to join in. We're also holding engagement sessions through our practice weeks, through workshops, and through mini staff conferences, and also we're coming together virtually to celebrate good practice and undertake kind of mini reward ceremonies as well. So it's challenging times, but we're doing what we can to support staff. Obviously, the council has an employee assistance programme where any members of staff, including our social workers, are able to access some personal support and counselling if that's what they need. They don't need to share with their manager that they're doing that, and that's a free service that they can access any time. And we've obviously been doing a lot of work to promote that service, and we have quite good feedback from staff who've taken up that service as well. We're obviously continuing to encourage staff to have their vaccines through the council, and a good many of our social workers have done that, and all of our social workers and a lot of our other practitioners also have ready access to the frequent testing, and again we're continuing to support staff with that, and also to provide PPE where they need that protection to be able to undertake some of our safeguarding visits.
Do I take it? That's it? It's finished?
Yes, that's it.
Thank you so much, both of you. And I'm really, really pleased to know that we look after clients, but we really need to look after the staff. And this is what you're doing, because without that, we won't get anywhere. I have a question for Elle. Tonight is the first time I'm hearing that you're actually going. I probably missed something. And so I've been asked to ask if tonight is the last time we will have the pleasure of your company.
No, so I will be working my period of notice here in Merton. So I believe that I will be seeing you here at the CYP scrutiny panel before I go. So I'll be going at the in the early part of July. So there's time yet for you to see me again.
Thank you very much. We really don't want you to go just yet. Okay. Right now, I think we've got to, it looks like we've covered everything, but I probably left, Elle wants to speak, go ahead.
I just wanted to pick up. I did raise my hand at the beginning of the session electronically rather than waving on the screen, so perhaps that was my error. But the minutes from the February meeting, which I have in the pack that was shared, I don't know whether when they were published online, some parts of those minutes were missing, or if there is some of the minutes missing. But the discussion that we had in February around the departmental update and around the performance, I can't see those in the minutes or the copies of the minutes that I have, and so I was just wanting to flag that to the committee before they were finally signed off.
Right. Okay. I'll have a discussion with Stella and we'll find out what happened there. Okay, but thanks for bringing it to our attention. Okay. Oh, more. Haley and then James, please. Haley, yeah.
Yes, that's sorry to take myself off mute, Chair. I'll just say I'm really sad to see you go. I think you've been a great asset, and you'll be really missed. I think you can be a great loss to Merton, and I really wish you all the best. But I'll save those till the next meeting. It sounds like, which is wonderful. My question was also, when would your last meeting be? And my question as well was, in percentage terms, what has been the uptake of vaccinations by the social workers?
So in percentage terms, the uptake of vaccinations through the council, I understand our last figure was 52%. However, that doesn't capture staff who have had their vaccinations through their own GP or through their CCG arrangements where they live, because a number of our staff do live and work in Merton, but a number of our staff don't. Staff, there's no requirement for staff to share with us whether they have or haven't had their vaccine. So anecdotally, we believe that the uptake of the vaccine for our social workers is much higher than the 52%, and the 52% is purely through the council. So in absolute terms, Haley, I can't tell you what the percentage of vaccinated social workers is. I can tell you who's had it through the percentage through the council, but I can tell you there's a number of colleagues who've had their vaccinations elsewhere, and there's no requirement to report it. We can ask if social workers will report it voluntarily, but there's no requirement for them to tell us, so we don't know the absolute number.
Okay, thank you, Elle.
Thank you. Carl, was your hand up? Carl? No. Okay. James then, please.
Thank you, Chair. Just very quickly, I agree with what you've said and Councillor Omrod said about Elle. I'm sorry to lose you as well, and you'll be a hard act to follow. My comment was, I hope that we that we can, Chair and Director, I hope we can switch back to the normal way of doing the department update as soon as possible, because it really is a very good and thorough report that we receive, and it's so useful for us as councillors. And Chair, the third point, given the last meeting was not without some controversy, perhaps as the directors address the issue of lavender as a governor of Melbury, could I just record, it's not a pecuniary interest, but can I just record for good measure that I did declare an interest in that subject. Thank you, Chair.
Thank you. I think we know that you're the chair anyway, James. Yeah, thank you. I take it we've come to the end, James?
I think there's just the performance report, Chair.
We still have that. I thought we've already incorporated that.
I think it's quite short.
Okay. Go ahead then, please.
Colleagues, I will keep it very short. You have received the performance information in the way that you are accustomed to, and you have a cover report which outlines any exceptions to our performance reporting. I will keep it really short. I want to highlight 2.11 really mainly. In the last meeting, I had to report that our assessment timeliness had dropped below our, and this is the 45-day target that we set ourselves. Well, it's a statutory timeframe we set ourselves to complete social work assessments. I had to report that it had fallen for the first time in a long period under the 90% target, and we provided an explanation for that in February's meeting. What I want to report at this meeting is that we are back over the 90% just. Of course, there's room for improvement, but we are back into the area that we would consider useful. It doesn't mean to say that we would always strive to make the 100%, of course, but I wanted to particularly draw attention to that aspect, and I'm open for any other questions.
Okay. No. Can I just intervene for a minute? I think Rose, was that your hand up? Did you put your hand up? Rose? No. Okay. Any questions for Carl, please? No, I think everybody wants to go to bed. I was going to say home, but I think they might be at home already. Right, okay. We've got just the worksheets left, and we don't need the officers for that. Something was sent out. So the officers, if you want to go, you can go, please. But we on the worksheet, there was an email sent out some time ago. I don't think the response was very good. I haven't added anything either, so shame on me. So we need to discuss this. And so I just need to bring in Stella to find out what's the best way she wants us to do it.
Yeah, it's just for members of the panel
That's
to
right.
put forward any suggestions that they would like, of topics that they would like to see the new municipal year. These will be scoped and discussed with officers on the best way they could be approached, and included as part of a long list of topics which you will discuss at a topic selection workshop in June, where you will then have an opportunity to whittle it down into a short list of topics and then developed into a work program. I think at this late hour, if you can just make suggestions, and then I can do some more work in sort of developing them into ideas. Perhaps liaise with you if you prefer.
Can I just intervene? It looks like everybody's brain has been exhausted. Can we just give some dates, and very short dates, probably by, say, Monday, to send everything to you? Would that be too late?
I mean, a week would be fine, Chair.
Yeah. So if we could do that, please, and I shall do my own homework too. And if we take into account that some of the things on the last one wasn't covered anyway because of COVID, so we probably need to look at those. Eleanor, did you want to say anything?
No, not at this point. I think everything's been covered that I would have said, and we'll get back to it. Yeah.
Thanks. Okay, Councillor Henry, probably last question.
Thank you, Chair. Not a question. I just would like to thank all the officers, every single person in the panel, for all their support to our family, especially where it comes around food, school meals, and especially during the winter period when it was very difficult time for everyone. Just want to say thank you all for keeping everybody together and supporting our schools and family. Thank you.
And thank you. And anyone else? Okay, James, yeah.
Yeah, very quick one. I agree with what Councillor Henry's just said. I know we've just been through an exceptional time. I know that, and I'm very supportive of all the work that officers have done and the cabinet member. But as part of getting back to normal and getting life back to normal and showing the community that we're getting back to normal, I hope in future meetings that we will restore quickly the cabinet member section where the cabinet member gives us an update and we have the opportunity to provide challenge there as well. It's not a criticism. I know where we've been and I'm very supportive of that, but I'm also quite keen that we get everything back to normal as quickly as we can, because I think that's good for the people who elected us. Thank you.
Okay, anybody else want to say anything before I have the final word? No?
Yes, please.
Okay, Hayley.
And I'm so sorry, Chair, and I should have emailed you this week. I did speak to Jane about this, and I raised it at Budget Council, but I would like to bring an AOB item, which I haven't formally sent to you, and my apologies for that, but that is, but hopefully you're agreeable for me to set up a mental health task group, particularly for children after what they've actually gone through. And that's something that I would actually like to be minuted as well, please.
Right, and if I can see a lot of nodding, and as somebody who studied in mental health as well, and did a lot of work with children, I totally agree.
Okay, thank you.
So, yeah.
And apologies if you thought I didn't do things properly. I forgot to email you, Chair.
Chair, can I just say that the panel did just to highlight that the panel did a task group on children's mental health prior to the pandemic. I think that was the last task group review that they did.
And
yeah, that's right, Stella, they did. You're absolutely right, but I think we're in a different state of the nation at the moment, really.
So can I just confirm that is this a review that you're going to be doing sort of independently or as part of this panel, just so that I can confirm for the minute? I'm not clear what the process is we're following.
Well, I think usually, I think it's any members of this panel, from what I recall, plus any other expertise in terms of people who may want to join as well. Apologies for not actually doing the AOB before Jane left, because Jane has been part of that conversation along with me and Hannah had some clear views on this also. So maybe that's something that we need to clarify.
Okay, so I put it's a review that we're going to clarify the sort of and bring it back to the panel for agreement.
That's probably with the crossover with the handover between Hannah and Jane.
Right, okay.
Whatever we're doing, can we make sure that we get it done, the results back, so that we can speak to Stella, because June is just around the corner. Okay, please.
Yeah.
Joan?
Oh, I don't know if this is the right place. Possibly I may need to speak to Stella, but I was thinking about a task group in dealing with bereavement where young people are concerned.
Yeah, but what we're saying is because all of us are tired, write it down, send it in by Monday. Yeah.
Okay,
so
thank
if
you.
all of us do some homework, send it, then we have something to look at and discuss. Yeah. Okay then. Anybody else? Yes, Roz.
I just want to check who we send it in to. Would that be via Stella?
Stella.
Stella.
Yeah.
Thank you.
Thank you very much. Thank you all very much indeed. And I don't know if I should make an apology. My note said that 10:15 is when the meeting finishes. And I did think, what, 10:15? Well, it's not 10:15 yet. It's 9:44. So we're going off a little early. But thank you for your stamina, your questions, everything. It's been very interesting. And I think that we've done what we're supposed to do. And James, all the things that you've mentioned, we will look at them, because some things need to be made more condensed, and we need to look at. We in our pre-meeting we spoke to the senior officers about what probably should be written at the beginning of the sheet, so that we don't have to go into depth, because there's like a summary of that reflects what's there. So we'll go through that and see where we are. Okay.
Thank you, Chair. Thank you.
And so thank you all very much, and have a great night. And remember, you don't need to catch a bus home if you're already home. Thank you.